Every morning, your body wakes up before you do, your blood thickens, your heart rate rises, and your arteries tighten to prepare for the day ahead. That's why most heart attacks and strokes happen between 6 and 10 a.m., when your heart is under the most pressure. But here's the good news. With just a few intentional habits in your morning routine, you can completely change how your heart starts its day. By gently rehydrating, improving oxygen flow, and calming your stress hormones, you can train your heart to stay strong, steady, and protected all day long. In this video, you'll discover a doctor-approved, science-backed morning routine that lowers blood pressure, keeps arteries flexible, and dramatically reduces your risk of both heart disease and stroke. Disclaimer: this video is for educational purposes only and not medical advice. Hydrate early, reboot circulation, and lower morning pressure. Before your first sip of coffee, your heart is already working overtime. The simplest way to ease that strain? A glass of water, the cheapest heart medicine on earth. When you wake up, your body's mildly dehydrated after 6 to 8 hours of sleep. During the night, you lose water through breathing and perspiration, and your blood becomes slightly thicker and more concentrated. That thicker blood forces your heart to pump harder, raising blood pressure and increasing the chance of a morning clot or stroke. In fact, research shows that the majority of heart attacks and strokes occur early in the morning, when dehydration and cortisol levels are both at their peak. By starting your day with water, before coffee, breakfast, or screens, you help your heart circulate blood more smoothly, prevent clot formation, and flush out toxins your body filtered overnight. It's a small habit with massive protection. What's happening inside your body? Your blood is nearly 90% water, and your heart depends on that fluid balance to function efficiently. When you rehydrate first thing in the morning, you restore blood volume, reducing the effort needed to pump blood. You support kidney function, helping remove sodium and stabilize blood pressure. You activate digestion and metabolism, supporting overall energy levels. You wake up the nervous system, preparing your body for healthy circulation throughout the day. When you skip morning hydration, your heart compensates by tightening blood vessels and releasing more stress hormones, a combination that raises pressure and increases cardiovascular risk. Dr. Insight. Cardiologists often refer to morning hydration as the first line of defense against vascular stress. Drinking 300 to 500 milliliters, 1 to 2 cups, of room temperature water after waking up helps thin the blood slightly, improving oxygen delivery to vital organs. A 2022 clinical study found that people who started their mornings hydrated had better endothelial function, meaning their arteries stayed more flexible and less prone to plaque buildup. Adding a squeeze of lemon or a few drops of apple cider vinegar can provide electrolytes and antioxidants that support heart health further. How to do it safely? Keep a glass or bottle of water by your bedside so it's the first thing you reach for. Drink 1 to 2 cups, 8 to 16 ounces, slowly within the first 10 minutes after waking. Avoid cold water first thing. It can briefly constrict arteries. Wait about 15 to 20 minutes before coffee or breakfast. If you take morning medication, have your water first. This ensures proper absorption and gives your heart a gentler start. Hydration is circulation. That first glass of water doesn't just quench thirst, it wakes up your heart, thins your blood, and lowers the morning pressure that triggers most strokes and heart attacks. Start your day by drinking, and you'll give your heart the easiest, safest start possible. Light movement or stretching. Wake the heart gently. The moment you open your eyes, your heart begins to pick up speed. But before you rush into the day, it needs a few minutes of gentle movement, not a shock of stress. Your heart and arteries are like an engine. They need to warm up before full speed. After hours of stillness during sleep, your circulation slows, and blood tends to pool in the lower body. If you jump straight into your morning rush, running upstairs, checking messages, or skipping breakfast, your heart suddenly has to pump harder against stiff, cold vessels. That's why cardiologists often say the first 30 minutes after waking are the riskiest window for stroke or heart attack. Gentle stretching or light movement during this time helps your heart wake up slowly, improving blood flow, loosening arteries, and stabilizing blood pressure. It's not about exercise intensity, It's about circulation consistency. What's happening inside your body? When you stretch or move gently, your muscles contract rhythmically, pushing blood from your legs back toward your heart. This simple act increases venous return, the amount of blood flowing back into the heart, without causing strain. Here's what happens in detail. Oxygen delivery improves. Each slow movement signals your heart to distribute oxygen evenly through your tissues. Blood vessels open up. Stretching triggers nitric oxide release, helping arteries expand and relax. Blood pressure stabilizes. Gentle movement reduces overnight fluid retention, preventing sudden BP spikes. Clot risk drops. Muscle activation prevents morning blood thickening from turning into dangerous clot formation. In short, light morning activity is your natural circulation booster. It wakes your cardiovascular system up safely and efficiently. Dr. Insight. Cardiologists recommend 5 to 10 minutes of light stretching or movement as soon as you wake up. It's particularly important for people with hypertension, diabetes, or poor circulation. Some effective examples include neck rolls and shoulder circles to loosen upper body tension, ankle and wrist rotations to improve blood flow to extremities, gentle side bends and torso twists to activate the core and improve flexibility, slow marching in place or walking around the room to boost circulation. You're not exercising for calories here. You're exercising for circulation and stability. Even gentle yoga or slow Tai Chi movements are shown to reduce systolic blood pressure and improve endothelial artery lining health. How to do it safely? Start slowly, move your joints through their natural range of motion. Breathe deeply with each stretch to maximize oxygen intake. Avoid sudden movements or high-intensity workouts right after waking. If you feel dizzy or lightheaded, pause, sit down, and breathe slowly. This gentle start allows your body to fully switch on before you begin more demanding tasks. Movement is medicine, especially in the morning. Just 10 minutes of light stretching gives your heart a graceful start, keeps your blood flowing, and protects your arteries from early morning stress. Deep breathing or meditation balance stress hormones and calm the heart. Your day hasn't even started, but your body is already under pressure. The secret to protecting your heart isn't found in pills, it's in your breath. The moment you wake up, your body naturally releases cortisol, the stress hormone, to prepare for the day. That's normal, but if cortisol levels stay high, your blood pressure rises, arteries tighten, and your heart beats faster than it should. This is why people often feel tense or anxious in the morning without knowing why. Their body is literally in fight or flight mode before breakfast. Deep breathing or morning meditation helps you shift from stress to calm. It lowers cortisol, reduces blood pressure, and allows your heart rhythm to stabilize before the demands of the day begin. Think of it as putting your heart in a calm gear before traffic starts. What's happening inside your body? When you take slow, deliberate breaths, your parasympathetic nervous system, the body's rest and repair mode, activates. Here's what happens next. Your heart rate slows, improving oxygen efficiency. Arteries relax, easing pressure on vessel walls. The heart's electrical rhythm becomes smoother, reducing risk of arrhythmias. Blood oxygen levels rise, giving your brain and muscles a healthy start. On a hormonal level, deep breathing reduces the release of adrenaline and cortisol, the very chemicals that trigger high blood pressure and inflammation. This effect isn't temporary. Consistent breathing practice improves heart rate variability, HRV, a measure of how adaptable and resilient your heart is to stress. In simple terms, the calmer your morning, the stronger your heart's defense system. Dr. Insight. Cardiologists now recommend daily relaxation practices as part of heart disease prevention. A 2023 study found that just 10 minutes of mindful breathing or meditation per day lowered systolic blood pressure by an average of 8 to 10 points, comparable to some first-line medications. Even short sessions help. You don't need to meditate like a monk. A few focused breaths in bed or during your shower can make a measurable difference in your heart's workload. How to do it safely. Sit or stand comfortably with your back straight. Inhale deeply through your nose for 4 seconds, hold for 2 seconds, and exhale through your mouth for 6 seconds. Repeat this for 5 to 10 minutes while focusing on your breath or calm thoughts. You can also try simple guided meditation apps or calming background sounds. If you struggle to stay still, focus on rhythmic breathing while stretching. This combines circulation and relaxation beautifully. Pair your breathing with a simple affirmation like, "My heart is calm. My body is safe." This subtle mindset shift sends powerful signals through your nervous system to support relaxation. The calmer your breath, the stronger your heart. Start each day with a few quiet minutes of mindful breathing, and you'll build inner balance that protects your arteries from stress all day long. Eat a heart-healthy breakfast. Fuel your arteries right. Breakfast isn't just about energy, it's your heart's first shield of the day. What you eat within that first hour can either protect your arteries or quietly harm them. Skipping breakfast or eating the wrong one sets your cardiovascular system up for stress. After fasting overnight, your blood sugar is low and your body craves nutrients to stabilize pressure and energy. If you grab sugary cereals, pastries, or coffee alone, your blood sugar spikes, triggering inflammation and artery constriction within minutes. In contrast, a balanced, heart-friendly breakfast stabilizes blood sugar, lowers LDL cholesterol, and fuels the body with antioxidants that fight oxidative stress, one of the main causes of heart disease and stroke. People who regularly eat a nutritious breakfast have lower rates of hypertension, obesity, and atherosclerosis. Simply put, your morning meal programs your heart for the rest of the day. What's happening inside your body? After 8 hours of sleep, your heart and brain need glucose for energy, but they also need nutrients that protect arteries from damage. A heart-healthy breakfast does this in several ways. Fiber from oats, fruits, or seeds binds excess cholesterol, helping clear plaque from arteries. Healthy fats from nuts or avocados strengthen vessel walls and improve blood flow. Protein from eggs or yogurt stabilizes blood sugar and keeps you full, reducing overeating later. Antioxidants from berries or green tea neutralize free radicals that damage heart tissue. Together, these nutrients create a steady energy flow without spiking blood sugar or blood pressure, both major stroke triggers. Skipping breakfast, on the other hand, forces your body into stress mode, increasing cortisol and heart rate. Over time, this can lead to insulin resistance and chronic vascular inflammation, a dangerous combination for your heart. Dr. Insight. Cardiologists emphasize that breakfast consistency matters as much as content. A 2021 study published in the Journal of the American College of Cardiology found that people who ate breakfast daily had 20 to 30% lower risk of heart disease compared to those who skipped it. The best morning meals follow the 3-3-3 rule. 3 grams of fiber from oats, flaxseed, or fruit. 3 grams of healthy fat from nuts, seeds, or olive oil. 3 grams of protein from eggs, Greek yogurt, or lentils. This trio keeps arteries smooth, inflammation low, and blood pressure steady. How to do it safely. Choose whole grains like oats or whole wheat toast instead of refined carbs. Add berries, apples, or bananas for natural sweetness and antioxidants. Include a handful of nuts or seeds to supply magnesium and omega-3s. Replace fried foods with boiled or poached options. Drink green tea or lemon water instead of sugary drinks. Consistency is key. Even small improvements make a difference when repeated daily. Your breakfast is your first act of heart care. Feed your arteries real food, and they'll thank you with smooth blood flow, lower pressure, and long-term protection against stroke and heart disease. Morning sunlight exposure. Boost circulation and vitamin D. Before you check your phone, step outside. 10 minutes of morning sunlight can do what no supplement can. It strengthens your heart, balances your blood pressure, and protects your brain. Your heart and blood vessels respond directly to light, especially the gentle rays of early morning. When sunlight hits your skin and eyes, it triggers a cascade of biological reactions that lower blood pressure, improve mood, and balance your body's natural rhythms. Morning light exposure helps your body produce vitamin D, a nutrient that plays a crucial role in regulating blood pressure, reducing inflammation, and strengthening heart muscle tissue. Deficiency in vitamin D has been linked to a higher risk of heart attack, stroke, and hypertension. But sunlight does more than make vitamin D. It sets your entire cardiovascular system in sync. What's happening inside your body? Here's how early sunlight benefits your heart on multiple levels. Triggers nitric oxide release. Sunlight exposure causes your skin to release small amounts of nitric oxide into the bloodstream. This compound relaxes arteries, improving blood flow and lowering blood pressure. Boosts serotonin and endorphins. These feel-good hormones reduce stress, calm your nervous system, and lower heart strain. Regulates circadian rhythm. Exposure to natural morning light tells your brain it's daytime, balancing cortisol levels and improving nighttime sleep, which is critical for heart recovery. Supports vitamin D synthesis. Vitamin D helps regulate calcium levels, preventing artery calcification and stiffness. When you skip sunlight, especially during early hours, your body misses out on this natural cardiovascular tuning. Over time, low vitamin D and poor circadian rhythm contribute to high blood pressure, chronic inflammation, and poor vascular elasticity. Dr. Insight. Cardiologists increasingly recognize light exposure as a non-drug therapy for hypertension and heart disease prevention. A major study in the European Heart Journal found that people with higher vitamin D levels had up to a 30% lower risk of cardiovascular mortality. Doctors often recommend 10 to 20 minutes of morning sunlight exposure before 10 a.m., when UV levels are gentle and safe. It's particularly beneficial for seniors who often have lower vitamin D synthesis due to thinner skin and less outdoor time. And remember, the goal isn't tanning, it's tuning your body's internal clock and fueling your arteries with natural energy. How to do it safely. Step outside for 10 to 20 minutes within the first hour after waking. Let sunlight touch your face, arms, and hands. No sunglasses for the first few minutes. Combine it with your morning walk or stretching for double benefits. In colder months, consider vitamin D3 supplements as advised by your doctor. Avoid prolonged exposure after 10 a.m. when UV intensity rises. This short window of gentle light primes your body to perform better all day, physically and mentally. Sunlight is your heart's natural signal to start the day. A few minutes each morning lowers stress, improves blood flow, and helps your heart and brain stay young. No gym, no medicine, just light. Avoid early morning rush and stress. Protect your arteries from adrenaline. Your alarm rings, you check your phone, rush through the shower, skip breakfast, and sprint out the door, and your heart is already in crisis mode before 9 a.m. The biggest threat to your heart in the morning isn't just poor diet or lack of sleep, it's rushing. That frantic start floods your bloodstream with adrenaline and cortisol, the body's fight-or-flight hormones. These chemicals are designed to protect you in emergencies, but when they're released daily by stress, they tighten your arteries, spike your blood pressure, and strain your heart muscle. Research shows that early morning stress doubles your risk of hypertension, arrhythmia, and cardiac events. Your heart works hardest in the first few hours after waking. That's when blood is thickest and pressure peaks. Adding emotional or mental stress to that mix is like stepping on the gas while the engine's still cold. Calm mornings don't just feel better, they're life-saving. What's happening inside your body? When you wake up, your body naturally produces cortisol to increase alertness. That's healthy. But when you add rushing, worry, or multitasking, your stress hormones shoot far beyond normal. Here's what happens next. Arteries constrict, limiting blood flow to the heart and brain. Blood pressure spikes sharply, sometimes by 20 to 30 points. Heart rate rises, forcing the heart to pump harder. Blood becomes thicker, increasing clot risk, especially dangerous for those with atherosclerosis or high cholesterol. Over time, this morning stress pattern causes chronic inflammation, damages the endothelial lining of arteries, and leads to faster plaque buildup. The opposite is also true. Slow, peaceful mornings trigger your parasympathetic nervous system, lowering pressure, improving circulation, and setting a calm tone for the entire day. Dr. Insight. Cardiologists often call the first hour after waking the golden hour for prevention. It's the period when controlling stress makes the greatest impact on heart protection. Studies have shown that people who start their day calmly through mindfulness, stretching, or quiet preparation have lower resting heart rates and reduced risk of cardiovascular events. Even something as small as avoiding phone notifications during your first 30 minutes awake can dramatically lower cortisol levels. Doctors recommend planning mornings the night before, setting out clothes, prepping breakfast, or writing a short to-do list so your brain starts the day in control, not chaos. How to do it safely. Wake up 10 to 15 minutes earlier than usual to give yourself breathing room. Avoid checking your phone or email for at least 20 to 30 minutes after waking. Keep mornings quiet, play soft music, or enjoy silence while preparing for the day. If anxiety rises, use deep breathing or short gratitude journaling to calm your nervous system. Move slowly. Your heart prefers rhythm, not rush. By protecting your morning peace, you train your heart to operate from calm, not crisis. A rushed morning is a stressed heart. Give yourself time to breathe, move, and start gently, because peace in the first hour can mean protection for the next 24. Your ideal 1-hour morning plan, a routine that keeps the heart calm all day. What if the way you spend your first hour could predict the strength of your heart for the next 24? The truth is, it can. Your morning sets the tone for every heartbeat that follows. The first 60 minutes after waking determine whether your cardiovascular system begins in balance or in chaos. Most people unknowingly start their day in a way that increases their stroke and heart attack risk, dehydration, rushing, skipping breakfast, and stress spikes. But the right morning routine does the opposite. It gently activates your heart, balances your hormones, and strengthens your arteries before any damage can begin. This 1-hour plan is not about perfection, it's about flow. Each habit builds on the next, creating a rhythm that keeps your blood pressure steady, your mind calm, and your heart protected all day long. Minute 0 to 10. Rehydrate and reboot. As soon as you wake up, drink 1 to 2 glasses of room temperature water. This simple act restores your blood volume, improves circulation, and reduces the early morning risk of clotting. Sit for a moment, stretch your arms, and breathe deeply as your body wakes up. Pro tip: add a slice of lemon or a pinch of pink Himalayan salt to your water for natural electrolytes that balance hydration and nerve function. Minute 10 to 25. Move and mobilize. Next, begin light stretching or gentle movement. Do 5 to 10 minutes of easy yoga, arm rolls, or marching in place. This wakes up your joints, sends oxygen-rich blood through your arteries, and helps flush out stagnant circulation from the night. Even slow-paced movement lowers morning blood pressure and boosts nitric oxide, your body's natural artery relaxant. It's like warming up your car before driving. Your heart performs better when it's not forced to sprint cold. Minute 25 to 35. Breathe and center. Find a comfortable spot to sit and breathe. Inhale through your nose for 4 seconds, hold for 2, and exhale slowly for 6. This activates your parasympathetic relaxation system and signals your heart to slow down. Pair your breathing with gratitude. Think of 3 things you're thankful for. This single habit reduces cortisol, improves heart rate variability, and sets a calm emotional tone for the day. Pro tip: keep your phone on airplane mode until after this step. Your heart doesn't need a flood of notifications before peace. Minute 35 to 50, eat a heart-healthy breakfast. Now give your arteries the nutrients they need to thrive. Choose a balanced breakfast that includes fiber, protein, and healthy fats. Try a bowl of oats with berries and flax seeds, scrambled eggs with avocado toast, Greek yogurt topped with walnuts and honey. This combination stabilizes blood sugar, reduces artery inflammation, and keeps you full for hours, preventing energy crashes that stress the heart later. Doctor's tip: avoid sugary cereals, pastries, or heavy fried foods. They cause a rapid insulin spike that inflames arteries. Minute 50 to 60, step into the light, literally. Finish your morning by stepping outside for 10 to 15 minutes of sunlight or gentle walking. Sunlight boosts vitamin D, balances blood pressure, and synchronizes your body clock, helping you sleep better at night, a key part of heart recovery. As you walk or stand, focus on breathing slowly and enjoying your surroundings. This final step grounds your body, clears your mind, and completes your full circle heart protection routine. How it all works together. Each step of this morning plan prepares your heart for a smoother, safer day. Hydration restores flow. Movement enhances oxygen delivery. Breathing regulates hormones. Nutrition fuels artery health. Sunlight resets your internal rhythm. Calm lowers inflammation. Together, they create a heart shield that lasts for hours, keeping your arteries relaxed, your pressure balanced, and your mind steady. A healthy heart isn't built in the gym, it's built in the first hour of your morning. When you start your day with calm, hydration, light, and nourishment, you give your body the strongest medicine of all, balance. Conclusion. Your morning is more powerful than any pill. Those first 60 minutes decide whether your blood flows smoothly or struggles, whether your arteries stay relaxed or tighten. When you drink water, stretch, breathe deeply, eat wisely, and move with calm purpose, you're not just starting a new day, you're giving your heart another decade of strength. Every heartbeat thanks you for slowing down, for listening, for choosing balance over rush. The science is clear. People who follow calm, consistent morning routines have lower blood pressure, stronger arteries, and fewer strokes. And it doesn't take perfection, just consistency. Protecting your heart is simply a series of small, loving choices repeated each day. So tomorrow morning, before you reach for your phone, reach for your water, your breath, and your peace, because that's where prevention begins. Disclaimer. This video is for educational purposes only and not medical advice. Always consult a qualified healthcare provider. If this video gave you a heart-healthy start, like to spread awareness. Subscribe for more doctor-approved heart and stroke prevention tips. Share, one morning routine could save a life. Thanks for watching.